Hi, my name is Tony Aldave. I'm the Chief of the Cornea Service at the Stein Institute, and it's a pleasure to give you a tour of the cornea clinic here at the Institute. We have 8 examination lanes, 3 on this side and 5 on this side. As you can see, we also have 2 waiting areas for patients, which have been configured in the era of COVID to ensure that we don't have too great a patient density in any one area. It's a nice bright space, as you can see, art on the walls, big windows here behind you. And so it's a nice place for patients to be, although of course as it's a waiting room we try not to keep them here too long. The normal flow in the clinic is that the patient will see a technician first. After that, then either a resident, a fellow, a U.S. fellow, or an international fellow will see the patient, and then the patient will see the attending physician. Some of my colleagues will actually see the patient together with the resident or fellow, whereas my preference is usually to have the resident or fellow see the patient first, then I see them later, and then after the clinic we'll discuss the patients together. Let's take a look at some of the other facilities we have here, including the examination room and diagnostic testing room. So we're now in one of the 8 examination rooms, and they're all configured really about the same. We have the electronic eye charts in each room, as we do in this one. And I think what's most important really is the quality of the slit lamps. We have the Hogstrite 900 BQ or BM slit lamp in each of the exam lanes. And I really think that's important to allow you to see the subtle details of the anterior segment during your examinations. Several of the exam rooms also have photographic capability, actually this one and another one. And this is a patient we just saw a few days ago, obviously with a cataprosthesis and an infiltrate, something you'll see, unfortunately, here if you come to do your fellowship with us. We have electronic medical record system. We use Epic, as many of the big academic centers in the country do. And as you may know, what's nice is that if you're seeing a patient who has seen another provider who uses Epic, many times you're able to access those records. So welcome to the inner sanctum of the cornea clinic. This is a back hallway via which the providers can move from room to room without having to go through the waiting room and face the angry mob of patients wanting to know how much longer it is till they're seen. So this is something that I think is relatively unique in this cornea clinic. I haven't seen it in many other places. So we're here now in the minor procedure room, which is adjacent to the cornea clinic. And it's really nice having a minor procedure room where you as the fellow can apply glue to a corneal perforation, replace a suture in a corneal transplant patient, perform epithelial debridement, superficial keratectomy, etc. Obviously, as anterior segment specialists, we often need to perform minor procedures, and these days performing them in the main operating room has become more cumbersome than ever in the era of COVID and requirements for COVID testing. This is a room that the fellows and the faculty use quite frequently. A dedicated microscope. We have a monitor on the wall on which the residents and fellows can watch procedures that are being performed if they're not doing them themselves. And I think it's a real plus that we have this room available to us in the cornea clinic area. So the newest addition to the South Diagnostic Room in the cornea clinic is this, a dedicated slit lamp camera. This camera, as you see, is hooked up to the computer. It uses the Hogstrite iSuite software to really facilitate image acquisition and indexing. I think having this here in the diagnostic suite and not having this in the exam room makes it much easier to collect photographs of patients because it won't interrupt patient flow. And I'm anticipating that by the end of the year, the fellows can amass quite a collection of images taken using this slit lamp camera that they can use throughout their career for educational purposes. So now we're moving into the North Diagnostic Room in the cornea clinic. We have, first of all, this device, which is a prototype OCT being evaluated by one of our colleagues in the uveitis service. This is the Pentacam HR corneal tomographer. Really a workhorse machine. We use this very frequently in our patients, not just your keratoconic patients, but patients with a variety of corneal disorders. I think it really is important for you as a fellow to go to a program where you have all these diagnostic instruments like the Pentacam to learn how to interpret the results and how that should then influence your patient management. The other instruments that we have in the North Diagnostic Suite in the Cornea Clinic include the OptiView OCT. We found the OCT really indispensable in our practices for diagnosis of a variety of inherited and acquired corneal disorders, and especially I find it very useful for preoperative planning for our patients, let's say prior to DALK, to obtain corneal thickness measurements, following surgery in a patient who's had DMEC or DSAC to look for detachments, etc. Something that we use a lot in our practice here. Another instrument that we use quite commonly is the confocal microscope. This is the HRT3. And I think a lot of fellowships won't have this instrument available. This is something which we have used a lot, primarily because my colleague Sophie Deng is a world's expert on limbal stem cell deficiency, and she has published several papers on the diagnosis and staging of limbal stem cell deficiency using confocal microscopy. We've also found this device to be very useful in terms of diagnosing infectious keratitis, primarily diagnosing fungal keratitis or protozoal keratitis. But I think everybody would agree that it really takes a particular level of expertise to acquire good images and be able to interpret those images. And I believe that we do have that expertise here, and it's something that you will learn from us if you do your fellowship with us. The Stein Institute consists of 3 buildings: the Wasserman Building on the left, the Jules Stein Building in the middle, and the Doris Stein Eye Research Center on the right. The Jules Stein Building is the first of the 3 buildings to have been built a little over 50 years ago. It recently underwent a seismic upgrading and complete renovation, so it's quite modern inside. This is the Comprehensive Ophthalmology Clinic, also known as University Ophthalmology Associates, or UOA, where the fellows see patients 1/2 day per week. Here's one of the exam rooms, and our current fellow, Dr. Daniel Kornberg, hard at work closing his charts after the end of a long clinic. Just across this plaza from the Jules Stein Building is the Doris Stein Building, in which you had a tour a bit earlier. And then across the circular driveway from the Doris Stein Building is the Wasserman Building, the newest of the 3 buildings. This was opened approximately 6 years ago. We see here the distinctive glasses worn by Mr. Wasserman and his wife. Fellows are here in the Wasserman Building seeing patients in the cataract and refractive surgery suites. A diagnostic lab in the Wasserman Building. Everything is brand new. Refractive laser, the Allegretto wave light, located on the 2nd floor. And on the lower level, the operating rooms. Unlike most operating rooms, this, even though it's the lowest level, it's a lot of light, high ceilings, you see very white, so it gives you an open, airy, welcoming feeling. There are 22 bays where the patients are brought before surgery and where they recover after their surgeries. There are 6 operating rooms, each with the Zeiss Lumera 700 microscope, and we also have a Zeiss Rescan, the microscope with intraoperative OCT. Each also has, you see in this room, a large screen on the wall, which really facilitates observation of the cases. Fellows also go to Harbor, UCLA Medical Center, 2 days a month, where they will work with UCLA affiliated faculty. So that's a brief tour of the Stein Institute. Hope it gives you a bit of idea of what our center is like, and we thank you for watching this video.